Well, vaccinations for the coronavirus here in the U.S. could begin in days. An independent FDA advisory board made up of nearly 24 doctors, including vaccine and infectious disease experts, will meet in a few hours to begin the authorization for approval of the Pfizer vaccine. This is the same vaccine that has already been approved in the U.K. Joining us now, a member of the President-elect's Coronavirus Advisory Board, Dr. Rick Bright. He is a top vaccine expert. I guess, thank you very much for being on the show this morning. My first question, I guess, would be, how prepared are we for distribution if approval comes?
Well, good morning. Thanks for having me on your show today. I mean, today is a really bad news and good news and then cautionary news day. I mean, the numbers that you read earlier, the 3,000 cases, deaths in America over the last 24 hours, people have trouble digesting those big numbers sometimes. I like to break it down by the minute. So every minute that ticks by on the clock today, we have 2 Americans die. We have over 150 new cases calculated every single minute. So we need to do everything we can to slow the spread and make sure people are wearing their face masks to help slow the spread while we can now. The meeting today, the good news, the advisory panel from the FDA, as you mentioned, is an independent panel. This gives me a lot of confidence. Science is at the forefront of reviewing these vaccines, and I'm hoping that it does get authorized today for emergency use. And that brings up the cautionary news, and that is, how are we going to distribute the vaccines when it becomes available? We know it's in very short supply. We know it's a complicated dosing regimen and a complicated distribution channel. And for all of the efforts that's gone into making the vaccine today, we haven't put equal effort into the downstream distribution and communication and preparation for the healthcare systems so people are ready to administer that vaccine. And we also haven't done a really good job yet of educating the public so they can trust that vaccine and understand the value of that vaccine. We need to invest in those local messengers to get the right message to people so they'll take the vaccine when it becomes available.
So, Katty Kay, especially since in your country it's underway, take the next question for Dr. Bright.
Doctor, thanks very much for joining us. We've seen the rollout now in the UK, and fairly soon, within 3 weeks, those first people who have got the shots will themselves now have immunity to the coronavirus. But I'm still confused about how much this is going to change daily life, because my understanding is that they can still infect other people. They might be immune themselves, but is there a possibility that those people who have even had the vaccines could go on to still shed the virus and potentially infect other people? Because if they can infect other people, doesn't that mean we're still going to be wearing masks, not traveling, that kind of thing for quite a while to come?
You know, it's a really important question. We're going to be wearing masks and following those public health guidelines for quite some time. We don't have enough vaccine to vaccinate everyone across the planet. We won't have for many, many months now. Even in the United States, it's going to take many months to make enough doses and distribute those doses and administer those doses in people. So it's going to take a while before people are even vaccinated. We still don't have the answer to the important question that you just asked. Once people receive the vaccine, we know from the limited clinical trials to date that it does prevent them, it seems to prevent them quite well from getting really sick and hospitalized and maybe even dying. But what we don't know is even if they're vaccinated, if they could get infected and spread the virus to other people. So that will be a very important follow-on clinical study that needs to occur so we have confidence in that information.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.